YouTube. And I already made an update for today. But I kind of wanted to talk about post-op depression, because I think that a lot of people are so excited to get like their surgery done that they don't think about how surgery is inherently a traumatic experience, and they don't think about how post-op how the recovery can just be really strenuous for you and for those around you. That being said, like, the last couple of days have been really hard on me emotionally, and I think it has to do with like sudden limited mobility. I'm not a really active person, but I'm also not like completely sedentary all the time, and so not being able to move is really difficult for me, especially because that means that I can't really go outside, and I can't really enjoy the fresh air, and so yeah, I've been trying to like make sure that I wash my face and like brush my teeth and stuff, and so I don't feel too gross and too cooped up, but it's not, I mean, it helps a little bit, but not entirely, and so I think setting up like a system of support would be really helpful, like specific people that you can go to for specific things. But that being said, like being under the Christian's like care as my friend, like he's my caretaker for this week, and so like that's been really hard and weird for me because I don't like asking people for things, and he's pretty much done everything short of like wiping my butt, and I haven't even pooped, so like, ow. So yeah, it's just been really tough having someone like literally take care of me and literally do everything for me. And I know that sounds like a weird thing to complain about or like to be depressed about, but it's just a really eerie feeling when you've never had to do that before, except for like maybe in your infancy. It's just weird. I don't know how to explain it. And that being said, like, as you know, as people who watch my YouTube videos or read my blog and stuff, like, I appreciate you checking in with me, and I'm sorry that I haven't like been as responsive as you'd probably expect, but I'm also like really super exhausted. Like I started rewriting my article for HuffPo because I wanted my friends proofread it, and they told me that I should make it a little more personal, and so I tried doing that last night, and like I reread it today, and I don't even remember writing those things yesterday. So yeah, I'm sorry that I haven't been like as responsive. Communication right now for me is like super exhausting, and like it's really hard for me to pay attention. It's just really tiring and super strenuous for me right now. And like making this video, for example, is really difficult. That being said, like I am documenting this whole process so that way like I can answer people's questions as they come up. But like asking me like really insensitive things that you know that I don't like, that if you had been paying attention you would know that I don't know the answer to, is like not cool. Like for example, a couple folks have been asking me like if my nipples look gnarly, and things like that, and it's like I don't know. I haven't been able to take off my bandages yet, so please don't ask me that. And like just like the whole phrasing, like, oh, so how bad does your chest look? Like that's just really fucked up, and incredibly insensitive, and Vicodin's like super fucking with my emotions. But yeah, anyway, so that being said, I want to bring the topic of like emotional stress caused by surgery, especially within the first week of recovery. I want to bring that to the forefront of like this conversation, because I feel like I feel like it's put on the back burner, or like people who are depressed during this time are like often invalidated. Their experiences are invalidated, or they're considered like not trans enough, and that's not cool. And so I would like to be able to engage, at least to the best of my ability, with other people who have felt the same way. This whole process has been like really hard for me. Not because I regret it, but because like surgery is scary, and because like I'm scared of being like triggered by the results, and like the whole concept of maybe not recognizing my own body is really weird to me. Like when I was a sophomore in high school, I had a really bad sinus infection, and one day I woke up and my face was so swollen that I couldn't recognize myself in the mirror. And like I'm kind of afraid that I may have that like reaction the first time I see my own chest, because I had an emotional breakdown when that happened to me. Not because it's like I don't see it as like entirely analogous, because like I didn't want the sinus infection. Ow. But I don't know if I'm making any sense at this point in time. I'm just rambling, but I just wanted to share these feelings because I feel like they're not generally shared very often, and when they are shared, I feel like people are shamed for it, and so yeah. I'll talk to you all later. Okay, bye.